not born in Liz Hurley's body and don't have that George Clooney smile, there are some things you can do to tweak your outer core. Dr. Shelly Kassam and Dr. Omar Kassam are doctors of dental surgery and founders of the Yaletown Laser Center, and it is my pleasure to welcome Dr. Shelly Kassam and Dr. Omar Kassam to Studio 4 to tell us more. Nice to meet you.
Good to meet you.
Doctors of dental surgery means what?
Dentists, basically.
Dentists,
general
okay.
practitioners, but you know, we do medical, like we look at it, dentistry, in a fashion that it'll take care of the whole body to some degree through teeth. This is why we would like the aspect of doctor to be enhanced.
Okay. Well, I'm a bit of a scaredy cat at the dentist. As you know, we were talking about it in the green room, but there are so many whitening options today and so many options to give us beautiful smiles. Where do you start? How do you begin?
I think the important thing is to get educated on what's available, and that starts with a really good treatment planning and diagnosis session, where you're really looking at the whole face as a concept, not just your teeth. So, for instance, if you had fractured lines, wear down, yellowing, then your option would be to go to veneers and a full smile makeover. If you had fabulous enamel, then all you need to do is use the laser to whiten it up somewhat.
Okay, are we born with fabulous enamel? Or are some people just born with it?
You are, and you cannot be. Personally, I had fluorosis. I was born in Africa, so I had brown stippling on my teeth because I had too much fluoride in my teeth. And then many years ago, Omar did some veneers for me, and they've been fabulous for me. Seriously.
And so it could be genetic. It could be genetic. Some families have whiter teeth than other families.
Yes, absolutely.
Some lucky ones are born with chiclets.
Yes.
As you know.
Even those darken over
shape,
time.
the position of teeth, etc. But now you can dare to dream. You can dream of the smile you dream of because of modern technology and modern dentistry. It allows you, if you're not born with it, things have happened, accidents have occurred, you've grown, teeth have grown crowded, that can be fixed now.
Exactly. Your brother jumped on your head when you were wrestling in the living room and your front tooth fell out. You mean that accident?
That's
yes.
sort of thing,
So it's more about the whole mouth or the jawline. It's about
the whole body,
the whole body, really, isn't it?
It really is, yeah. Omar is really into, why don't you actually tell him about what you're into right now?
Well, I think, you know, they say the mouth is the mirror to your health, and there's so much truth in it. And one of the things that we are finding in modern day dentistry is that we need to make sure that the bites are right. Because we have often too many teeth for our jaws, the teeth are often crowded. And so the way the teeth come together, rather than they're supposing to come together, you know, perfectly in harmony, they change their direction, and that stresses the muscle. Now, if that stresses the muscle, your whole body is out of kilter, as it were. An example would be if you had a pebble in your shoe, you would have that pebble that interferes with the way you walk, and that would affect your hip to that degree because you'd walk differently in order to avoid the pain. It's an avoidant bite pattern. So your mouth or your jaw is actually just a sling that holds your jaw to your head, and that sling compensates. So if you don't have the right bite, guess what happens? Often you can get headaches, you can get migraines, you can get neck pain, shoulder pain, etc. So as much as we love beauty, we do something called bioaesthetic dentistry. So take care of the biological function as well as the beauty.
That makes sense to me because I know if you have the TMJ,
Yes.
the tight, what does it stand for? Tight
Temporomandibular joint.
I knew you'd know that. Okay. So if you have this off, you're right, it can affect your whole body. If you have an abscessed tooth, it can poison your whole body.
Well, it does, and the fabulous thing now is that with lasers, it's so easy to get rid of the nidus of infection that's sitting in your mouth. That is, the infection is actually perpetuating down to your body. But in the old days, Fanny, when we had infection in your mouth, you either lacerated it or you watched it, and when the periodontal disease or something got really bad, then you went and had surgery. We don't have to do that anymore. We have this incredible piece of machinery that's a laser that's so narrow you can put it between the gum and the tooth, remove the diseased tissue, drain everything, and the body starts to kick itself back and heal itself.
It's a bloodless surgery in a sense.
Absolutely.
And the magic of the laser is it seals as it peels. It sterilizes the site. And the mouth is infected with so much bacteria that what you want is this. I mean, we see it in eye surgery, vision correction, the magic of lasers there, the medical world's using it.
Exactly. I mean, in science class grade 5, they said, remember, bacteria causes decay.
Absolutely.
And now we're flossing. We're doing all the right things, but sometimes God just didn't give you the perfect mouth or the perfect teeth, and there you are. And the gums thing. I was really intrigued by gum sculpting. What can be done if you show too much gum or too little gum?
It's so easy, Fanny. You basically, when people have gummy smiles, when they smile, that's all you see. And all their lives, you know, they're kind of conscious of it.
They don't smile so much.
They don't smile. They're sort of holding themselves back.
Right.
And all it is you take the laser and you basically it's like butter. You're just melting it away and sculpting it. So it's very artistic, and you're lifting the gums up so you're seeing more tooth tissue. Now, when you marry that with teeth that are crooked or otherwise, you can actually create the backdrop with the gums for really beautiful teeth. You get a really perfect picture at the end of it, and it's healthy.
As you know, in the olden days, if I dare call them the olden days, you knew when people, they'd get, I don't know if they were bridges or some kind of fake teeth, and they're like somebody plopped two big chiclets or Mickey Mouse teeth, Bugs Bunny teeth. And it's not attractive, because what you knew as somebody observing is that you weren't born with those teeth, and it just wasn't attractive. The gums were more attractive than the big teeth.
But Fanny, look at Shelly's teeth. We did them in 2001. All of her teeth
I'm not opening my mouth.
But all of her teeth are covered. She's got veneers on all her teeth, and they were crowded. So she had fluorosis, crowding of teeth, and we were able to do it, and they look fairly natural, even if I say so.
No, they do, but
no, they don't. Nobody knows. No, absolutely no. It doesn't hurt.
I mean, you're related to him, so you can tell me.
No, the thing is, in the old days, people were very, very concerned about pain.
Right.
Today's dentistry is very, very different. You know, when a patient comes to the door, it's a lifestyle experience. It's not something you have to muddle yourself through. You put your DVD on. The anesthetic shouldn't hurt. The injection. We do fillings without anesthesia now because we have a laser. We have an air abrasion unit. Dentistry is so much more pleasant.
So you can do fillings too?
Oh, absolutely. You can do porcelain, you can do bonded fillings, you can do a whole bunch of stuff without putting the patient through a whole bunch of aggravation, which is where the holistic approach is really important, I think.
Exactly. Whole body.
Whole body.
Preventive
Absolutely.
medicine. All of that.
All of that.